I'm certainly not the first person to say this, but all the good security people were network people first. You kind of
Oh,
sort of need to understand how the network works before you're in charge of protecting the network.
sure. Makes sense. Yeah. Welcome to Speed Data, quick conversations with cybersecurity leaders. I'm your host, Megan Garza. My guest today is JD Whitlock, the Chief Information Officer for Dayton Children's Hospital. Thanks for joining me on Speed Data, JD.
Pleasure to be here, mate.
JD has been at Dayton Children's Hospital for the past 7 years, where he currently leads a team of 140 professionals across infrastructure and operations, data services, cybersecurity, PMO, Workday ERP, and Epic HER, all in support of the $750 million pediatric health system. JD also owns a health technology and digital health consulting firm and is passionate about fostering innovation in healthcare. JD also has a creative background in marketing and media, specializing in SEO, website design, and mass communications, and volunteers in his community. JD has been active in Big Brothers and Big Sisters for more than 14 years and does prison fellowship at the Dayton Correctional Institution. That is really cool, and I bet it's really rewarding as well.
It is.
You oversee cybersecurity in your role as CIO. Working at a hospital, I know that any disruption to the business or cyber attack can literally be a matter of life and death. Working at a children's hospital, I imagine that danger feels even more crucial. In your opinion, what is the best way to defend against a cyber attack?
Anywhere in healthcare, we are very concerned about ransomware attacks. Of course, you can see in the press relatively, unfortunately, frequent hospitals being taken down by ransomware. Of course, we all have downtime procedures so that if and when things have to go down for whatever reason, we can still take care of patients as safely as we possibly can. But it is also true that typically what happens in those scenarios for longer term, a truly bad ransomware attack that really takes a hospital down for a period of weeks typically results in significant interruptions to care and, canceling of elective surgeries and that kind of a thing. So we are, of course, always doing everything we possibly can to defend against that. Dayton Children's is not a small organization, but a small health system. And so we're big enough to have a large attack surface from a cybersecurity perspective. So we have to be very careful about all that. And we, try to keep up with using the best tools that we can with our small team, and supplemented by some services for example, in the case of managed detection and response, that you sort of have to do if you have a smaller team, if you're not going to set up your own security operations center. So, defense in depth, zero trust, and all that good stuff. And we hope to keep the bad guys at least out of the family jewels, right?
Yeah.
So it's true in today's environment that you're never going to stop the bad guys from getting over that first wall with the sophistication of attacker in the middle, getting past MFA and all that. So we just, we hope you have the alerting and the tools in place to identify, account compromise very quickly after it happens.
Yeah.
And so that's what we are all shooting for.
Yeah. And I know that some types of malicious actors used to have a kind of, code of ethics where they wouldn't go after vulnerable individuals like children or the elderly. Do you find that to still be the case?
Well, no, obviously the bad guys are doing everything they can. Mostly they're out to, of course, make a buck. Of course, you also have the threat for nation state actors and advanced persistent threat and all that kind of stuff. And then you also have, based on, sometimes the attacks are very sophisticated, sometimes they're not terribly sophisticated, and sometimes it's script kiddies or people just banging on whatever they can find to bang on. And sometimes there's like spear phishing, at our executives and that kind of thing. So it's the whole spectrum of all that. But no, they certainly don't stay away because it's a children's hospital. No.
Unfortunately. What is your most dreaded type of cybersecurity attack?
So going back to the ransomware scenario, and it's what they get into with the ransomware, right? So obviously we don't want any ransomware, but if ransomware got onto, for example, an individual PC for one of our employees that this is not having elevated credentials, and we all are alerting, technology alerts us to that quickly, that's still bad. We
Yeah,
still failed on several levels that happened, but it's not necessarily an existential threat, and we can obviously correct the situation and reimage that PC and obviously kick the bad guys out,
sure.
reset password, all that kind of stuff. So it's really about how far the bad guys can worm their way into the back end of things. When you see really bad ransomware attacks that they've successfully gotten into the back end of the VMware or
Yeah.
whatever it is you're running your data center on. That's the worst scenario.
Yeah. And in addition to managing cybersecurity, you're also responsible for infrastructure, data services, PMO. What made you want to go into information technology?
I certainly didn't start out in information technology, so I'm retired military. Started out as a naval officer, did naval officer things, driving ships around for a while. Then I did a master's in healthcare administration. Just really got into healthcare administration. Swapped to the Air Force, did that healthcare administration in the Air Force, and then after I've been doing that for a little while, got into the IT side of healthcare administration, but now we've been doing that for a really long time, like 25 years.
Yeah.
So kind of came to it in sort of a roundabout fashion. I guess question is why did I stick with that? Because it's really fun. It's
Yeah.
always challenging. It's never boring. You get to the reward of helping all the caregivers take care of patients. And as I always tell my team, healthcare IT is not, if you want to be the hero, don't go into healthcare IT, go to medical school or nursing school.
Yeah.
We are here to support our caregivers.
Yeah.
There's not a lot of glory in that. But it's certainly a rewarding
Sure.
career in
Yeah.
terms of being excited to come to work every day.
Yeah. And speaking of your team, what do you look for when hiring new team members?
So that's a great question, and it is obviously dependent on the position. Of course, we always look for a great culture fit.
Yeah.
Every organization cares about culture fit. We do a really nice job promoting from within. On the tech team side, we are almost always looking for some entry level positions to come into our service desk or field support team.
Yeah.
And these folks sometimes they have a degree, but oftentimes they don't. We don't expect them to. And just yesterday, I was talking to some seniors in high school that are in an IT
Oh, cool.
vocational program
Yeah.
because we'd love to hire some because they're coming out of that program
Yeah.
when they graduate from high school with typically like an A+ and sometimes even a Security Plus certification, which is exactly what we're looking
Right.
for those positions. So that's one answer. Switching to the Epic side, the majority of our Epic team are nurses who used to be nurses at Dayton Children's. We do a lot of
Oh,
hiring
okay.
from within our nursing staff,
Yeah.
and I'm proud to say that we score very highly on the Arch Collaborative EHR satisfaction survey.
Mm-hmm.
And we win the award that they give out for that. It's called the Pinnacle Award. And now that is certainly multifactorial why we do well at that. And
Yeah.
it would be you could do a whole separate podcast on that. But
Yeah.
one reason I think that we do well is because of that,
Yeah.
because so many of our team that are doing the actual Epic build to support our caregivers used to be one of those caregivers.
Yeah.
And so
Yep.
they really understand their customer.
That perspective. Yeah.
Yeah.
And when you mention, bringing folks on in entry level positions, what does it take for them to become a successful security leader?
Our small cybersecurity team of 6 people, 2 people out of those 6 came externally. One of them was actually our CISO a retired Air Force cybersecurity operator.
Okay.
And so he was new to healthcare, but he knew a whole lot about
Yeah.
operationally protecting the network. I'm certainly not the first person to say this, but all the good security people were network people first. You kind of
Oh,
sort of need to understand how the network works before you're in charge of protecting the network.
sure. Makes sense. Yeah.
And so once again, position dependent, and obviously you hire the right skill set for the job.
Sure. And I mentioned a little bit about your volunteer work and passion for serving and outside interests. If you weren't in technology, what would you be doing?
If I weren't in technology and retired, or if I weren't in technology and not retired.
Let's do both.
Well, if I was retired, which I hope to be in 6 or 7 years here, I would be probably doing more volunteer work and let's see, reading more, going for really
Yeah.
long walks every day, things like that. If I were not retired, what else would I be doing? That's hard because believe it or not, I really love my job. And
That's good.
so I don't really want to do anything
Well,
else.
that's good. Then where you are is where you should be.
Clay.
You're doing what you love. So
You mentioned creative stuff and you mentioned that I had sort of dabbled in some of that, like the web stuff. I like that. I like the creative stuff. However, I think it's completely different if your main gig is creative. I think that totally shifts the joy of being
yeah.
creative
Yeah.
instead of doing it on the side. So
Yeah.
I enjoy creative side, but I would not want to do creative things
Right.
that my paycheck depended on. First of all, because I probably wouldn't make a very good paycheck. And secondly, because I want to keep the joy of it. I want to
Yeah.
do it on the side.
Yeah. And be like, if every meal you had was ice cream,
Right.
eventually you'd be like, I can't do this anymore.
For sure.
Well, thank you so much for your time, JD. I really appreciated it. For our audience, if you're interested in being a guest on Speed Data, visit varonis.com/speed-data. Thank you again, JD.
Thanks, man.